Hi, this is Dr. Bob Dannenhoffer, the Public Health Office from Douglas County with another of our Facebook Lives. Today is April the 9th, and this is a chance for you to ask questions. And the good news is a lot of people have already sent in questions at Facebook questions at douglaspublichealthnetwork.org. As always, we'll get to those first, and then when we're done, we'll take your questions that you can put in the chat section. So this is a chance for us to answer your questions. So as we always do, we start at the world level and then move down. So at the world level, 134 million cases, 2.9 million deaths, 840,000 cases yesterday, the second highest total ever in the world yesterday. This is terrible because many countries are having their highest rates ever during this pandemic. So as you remember, there was a first wave in spring of last year, maybe another wave in the summer, a big wave starting in October, November that peaked in January and then came down in February. But right now, the number of cases in the world is just where it was around the holidays. So that is very, very worrisome. And I think we've talked about this for several weeks, so it'll come as no surprise to those who are listening. What we're seeing is this is a broad-based increase with increases in Europe, in the Middle East, South America, and what we're seeing now is in the highest number of cases ever in India. India, a big concern, a big populous, crowded country, and 6 countries in Africa have a fair amount of disease. And Africa is a big concern because they're likely to start off with the 351 variant, which is a South African variant, and then get worse from there. Right, so when you get variants, it almost never reverts back to the easier forms. It always tends to revert to the more difficult variant. And remember that because we'll go ahead and do that later. So the world situation, very worrisome. The good news is the bright spots in the world are South Africa and the UK. The UK has done a great job with vaccination and a good job with lockdown after they had the UK variant there, and they're at a relatively low level. So that's good, but their decrease did not come without a considerable amount of pain. In the US, we're at 31 million cases, 559,000 deaths. I mean, yesterday we had 81,000 cases and almost 1,000 deaths. I mean, that's still striking. I mean, we don't have 1,000 deaths from anything else in public health in a day, right? We talk about the tragedies of gun violence, the tragedies of suicide, the tragedies in those cases, we have maybe 1,000 deaths a week. This is 1,000 deaths a day from this pandemic. So although things are getting better, and clearly in Southern Oregon, they're getting better, we still have a way to go in the rest of the world. And you'll remember that even if we could get our cases down to nearly zero in the U.S., there's going to be new cases imported, and there may be new variants, so that's a big concern. In the U.S., we're seeing a lot of cases in Michigan, Minnesota, in the Texas Panhandle. So the Texas Panhandle had been a few cases over the last few weeks and just absolutely blew up today. So Texas, which has gotten rid of its mask mandates, may be starting to see a real increase in cases. Florida, New York, and New Jersey seem to be the big places there. Oregon, our cases are slowly increasing. Our hospitalizations were slowly increasing. And it's kind of throughout the state. We're seeing it in the Tri-County area. In Lane County, has started seeing a big increase in cases. Klamath, Josephine, and Jackson. So it's a little worrisome there. And in Douglas County, we've been pretty quiet. We've been about less than 10 cases a day, which has been great. But still, that's 10 cases more than I'd like to see. And what we saw yesterday, that we had a breakthrough case. So breakthrough case is somebody who's fully immunized who now gets symptomatic disease. So this was somebody who was fully immunized who got symptomatic disease. And what we found is that this person had the 429 variant, which is the one that happens from Southern California. This 429 variant is very concerning because the 429 variant seems to be a bit more contagious, maybe 20% more contagious, something we don't need. And antibodies that you may have developed from either previous infection or from vaccination work significantly less well than with the other variants. And so this is a real concern, and this is why we want to get enough people vaccinated so this thing stops circulating at all. But if the neutralizing antibodies work less, it means that even more and more people will have to get vaccinated. So that's a real concern. The bright spot is vaccinations. We have so much vaccination activity in the county. So we've got 15 pharmacies. So basically all of the pharmacies in town have vaccine. Almost all of the big clinics in town have vaccine. 3 MS agencies have vaccine. Sutherland and Myrtle Creek have big events at Aviva this week, and they're going to continue to have events next week. We have another big event at the fairgrounds on April the 24th, and our Tiger team has started and is now going around. They're going to be in multiple places around the county next week, up at Toketee, out at the farms. So it's going to be just great. We're going to try and get all of these places around the county. But to do this, people have to get the vaccine. And one of the things we've noticed in Southern Oregon is that the demand for vaccine is not overwhelming. So we're not seeing hundreds of people calling every day saying, where can I get the vaccine? We have at this point about as much vaccine as demand. And what we fear is that if demand doesn't go up, we'll get to a point where we'll only have maybe 30 or 40% of the population vaccinated. And with only 30 or 40% of the population vaccinated, this will continue to circulate around. That's not very pleasant. In terms of testing, we're still doing a lot of testing. There's a good testing question in here that we'll answer later. So the first question is from Katie. She says she's in her early 40s, and she had her first Moderna dose and had 30 hours of misery. Fever, pain, nausea, headaches, sore throat, extreme fatigue, so bad that she couldn't get out of bed all day. Now I'm nervous about getting my second dose since it's supposed to be even worse than the first. All the info I find online seems to imply that this kind of reaction only happens after the second dose. That is not true. While reactions tend to be more common and more severe after the second dose, you can get them after the first dose here. Should I be concerned about getting my second dose? I don't mean feeling crummy for a few days, but I'm worried that my body's immune response may go dangerously overboard, and I think not. So the recommendations, if you've had a local reactions, it sounds like you did for the first one, that it just means your body's making a good immune response and that you should go ahead and get your second. You can certainly talk with your doctor, but the recommendation is that unless you had a severe allergic reaction to the first dose, and you don't suggest anything that suggests allergy, that you should go ahead and get your second. So Virginia says, well, I'm not an anti-masker, but what do you make of Texas cases not rising after their mask mandate was lifted on March the 3rd? And that's a good question, right? Because one of the things that we do to control this disease is masking and distancing. It's difficult to compare states because things happen differently in states. We have no idea why Michigan is so hot, yet Indiana, just south of the border, is very quiet, and there's not exactly clear that there's that much difference. Texas never had a strong mask mandate before, and they got rid of it. Texas is, as I said before, is very worrisome. They're starting to see a huge increase in cases in the Texas Panhandle. And again, whether you can relate that to masks or not masks, I don't know, in Texas. But the CDC did a very nice study where they looked at some of these public health measures that people put in, and it was pretty clear that that masks and distancing and closing restaurants really did make a difference. Now, not night and day difference, like a million cases and then you close restaurants and they all go away. Because remember, these cases take a while to sort out. You may give it to the person at home, or then may give it to another person. So none of these things happen on a dime either way. Either closures don't stop this disease on a dime, nor do openings cause it to increase. I think looking at the map today in Texas, I was really concerned about what's happening, because frequently what will happen is it starts in one part of a state and then it spreads to the rest of the state. As you can imagine, people might be like a sales rep for the northern part of Texas and they live in the Panhandle and then go otherwise. Sports teams from other parts of Texas may go up and play, and this is how it does spread around. So Virginia says, how and when can we watch your TEDx talk? I'm doing a TEDx talk tomorrow about the silver linings of the COVID pandemic. So there's lots negative about COVID, and you know I could go on for days about that. But there are some interesting things that we've seen during the COVID pandemic that may give us a hint for the future. So, for example, one of these is that the rate of prematurity really decreased during the lockdowns. And that was surprising because actually we expected the rate of prematurity to go up because of all the stress associated with the lockdowns. But instead of going up, it went way down. And it's now thought that the reason for that is that the one thing that people did do during the lockdown was sleep more. We all slept about an hour more during the lockdown. And so the thought is that pregnant women who are not getting enough sleep are at real risk for delivering prematurely. And when people were given the time for more sleep, the rate of prematurity went down. Unfortunately, as things opened up and people went back to work, the rate of prematurity came up again. But maybe in the future we'll recognize prematurity is such a terrible thing. I mean, is the leading cause of infant mortality. Maybe we'll figure out a way for pregnant moms to get more sleep. So there's 12 of those stories, so that's just one of them. So you can look at the TEDx Roseburg. TEDx Roseburg has a way you can buy tickets online. I think they're $10, and you can listen to all the talks. There's some of these other talks that look wonderful, far better than mine, but if you really must, that's the way to do it. So Bruce says, please talk about the blood clot cases in the U.S. tied to the J&J vaccine. So let's start with this. So, in Europe, they have the Astrozenica vaccine, and they've had a bunch of cases of clotting associated with that vaccine. These are usually in women 20 to 50, usually women are previously healthy, that a week or two after getting the vaccine, they have this syndrome of blood clotting and low platelets, which is an unusual situation. What's been most worrisome is that some of these blood clots have been in the veins around your brain, and when the blood clots are in the brain, in the veins around your brain, the blood has nowhere to go, and the pressure builds up, and it can be really very serious. So they've seen a number of serious cases and deaths. And this has caused some of the countries to limit the use of the Astrozeneca vaccine, especially in younger people. So I think when you get to be 70, the risk of this syndrome is lower and the risk of the disease is much higher. But if you're 25 years old, the risk of dying from the disease is low. And so you want to have a commensurately low risk of dying from the vaccine. So some of the countries have done that. An article came out in the New England Journal yesterday that looked at 5 cases. And they were worrisome because these were otherwise healthy people who had bad outcomes after the AstraZeneca vaccine. And what it seems to be related to something we've known for a long time called heparin-induced thrombocytopenia. So heparin is a drug that you use to decrease clotting. What they've recognized, though, is that in a small percentage of people, maybe 1 in 1,000 people who got heparin, that a week or two after starting the heparin, they would start having these funny clots and their platelets would be low, very similar to what we've seen in the AstraZeneca. And it's related to an antibody directed against heparin platelet factor 4. And so what they found in these people with the AstraZeneca vaccine, when they measured that antibody to heparin platelet factor 4, they all had high levels of that. So it may well be that this AstraZeneca vaccine, your body makes multiple antibodies. So rather than making sort of a single antibody to this, it makes as many as 20, 30, maybe even 50 different antibodies. And the thought is that maybe one of those antibodies in susceptible people causes this thing. So it's really a worry. Okay, so that's the AstraZeneca vaccine. Not approved in the U.S., not used in the U.S., so not a big deal. But since we know about this coming from the AstraZeneca vaccine, people are looking for like crazy for this associated with other vaccines. And as best as I can tell, they've not found a single case associated with Pfizer or Moderna. But reported today is that there were 4 cases associated with the J&J vaccine, but they're still in the early stages, so they don't know if they're this HIT thing or if they're something else. So what do we do with this? Well, I think I try and follow the best science. The best science is that the Pfizer and Moderna vaccines are incredibly safe and incredibly effective, that the J&J vaccine is very effective, and I think it's very safe, but I think we really need to very carefully follow the data. Now, again, think of the stuff in Europe. It's about 2 in a million. We did the studies today that looked today about what's the chance that a vaccine will prevent you from dying? Well, if you're young, it's hard to know. 20 to 50, it's hard to know because we've had no deaths 20 to 50, but we've had 65 deaths for people who are older, and we have about 35,000 people. So 35,000 people above 60. So the risk of the benefit of this vaccine not dying is far, 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 far greater than the risk of having this rare complication. But this is all stuff that we need to follow carefully. I'm thinking on the one hand, everybody says, oh, things are safe, don't worry about it at all, is whistling in the graveyard. On the other hand, people who say, well, a chance of 1 in a million is so high that I wouldn't get the vaccine, although the vaccine might save my life 1 in 1,000 times, doesn't make sense either. So I think we need to be very, very careful about this, really transparent with the data. And so I'll do the best I can to be open and transparent. So Holly says, I just got my second Moderna vaccine on Thursday, and I need to get my second Shingrix. What's a good amount of time to wait? So the studies on the Moderna and the Pfizer and the J&J didn't want to mix up vaccines, so they required that people not get other vaccines within 14 days of getting that. So I think waiting 14 days would be fine. Looks like that will still give you plenty of time, so I would wait 2 weeks in between. So Katie says, where can I get the J&J vaccine? So the J&J vaccine is especially in short supply. You may have read the news studies that the J&J that's currently available was made in the Netherlands and imported to the United States. And so there was going to be a U.S. manufacturer of this in a place outside of Baltimore. Unfortunately, they had manufacturing troubles, and this vaccine was not released. So there's a real shortage of J&J. So this week, Douglas County got exactly 0 doses of J&J vaccine. So there is short supply. Again, all of the vaccines work great, and there have been no safety issues with Pfizer and Moderna. So I just get the Pfizer or the Moderna. So my doctor says it's rare to get COVID twice. And I had it in November. Should I get the vaccine? So we do think that previous infection with COVID gives you about 80 or 90% protection against reinfection. And we've seen that most people who had disease last fall did not get it again this spring. Although it's not 100%, we do have half a dozen cases or so where people were infected in the springtime, got totally better, and then got infected again. One of the most notable ones was somebody who was actually back in New York during the terrible time they had in the springtime, and then was well, and then got it again this fall. So it does happen. It's not that it's not super rare, but it's not common. Really, if you've had it once, you should have 6 to 12 months of protection. So should you get the vaccine? Yeah, well, that's only 80 or 90% protection. With the vaccine, you'd get to over 90. So yes, I would get that. And Lisa says, I have a lot of food allergies. Will I be okay? So again, the story with allergies is we've given more than 30,000 doses in the community. We've had 3 moderate to severe allergic reactions. All have recovered. People who have had previous history of allergies, people who have had a history of anaphylaxis, far more likely to have reactions than people who've never had a reaction. So if you have a lot of food allergies, especially if you've had a severe enough one that you carry an EpiPen, you will be okay, but you should do this in a place. You should inform the people that you've had a reaction. Probably best to get this at a doctor's office if you're that person. So Betty says, I have been curious about the lack of reporting about testing in Douglas County. It used to be a routine part of the numbers in the news review. Can you send me the number of tests positive and negative in Douglas County for each month from September through March? I'm wondering if our drop in risk from high to extreme isn't directly associated with the drop in testing, unless the testing hasn't dropped. Trump feared more tests meant more cases. I'm thinking what it means is more tests, more confirmed cases. And so, so early on testing was a big issue, and it was published all the time. It's less of an issue now, so it doesn't get published. We still follow it. So the best place to follow this, and they have nice graphs, is if you go on the Oregon Health Authority page, go down to the dashboards. In the dashboards, go to testing. In the testing, go to county data. And what you'll see is that since November, we've had a very steady amount of testing. And this very steady amount of testing has not really gone up and down a little bit. Our number of positive tests increased in November and December when we had more cases, and has since come down. And then our positivity rate, that is the number of positive tests over the number of total tests, peaked in November and December and has been down. So our decrease in number of cases is not due to a decrease in testing. It is totally due to a decrease in the amount of disease. If it was simply due to testing, let's say everybody got together and said, we're not getting it tested, what you would see is the number of tests would decrease. Still, people are going to get hospitalized, would get tested, so you'd still get those positives, and your positivity rate would go up. So if we saw a rapidly declining number of tests and an increased test positivity, then that could be an example. We've not seen that. What we've seen is a very flat number of tests and a decreased positivity, suggesting that the decreased number of cases is because of a decreased amount of disease, and that's what we see. So somebody says, well, how are our doppelganger counties doing? So if you go back to August of last year when we did this analysis, what we were doing at that time was we tried to find other similar counties around the country and then see through time how we were all doing. And so we did that. And so Douglas County, a little over 100,000, no big cities, but we do have a central population area. We've got a mixed economy with agriculture, timber, and tourism. We've got nothing strikingly unusual about our population. Like we're not in with Disneyland. We're not in the middle of a national park or something. So we picked that, and then we tried to pick 3 other counties that were similar. So we picked Lowndes County in Georgia, which is where Valdosta, Georgia is, Pennington County in South Dakota, which is where Rapid City is, and Twin Falls County in Idaho, where the county and the city of Twin Falls is. So when we look at it, the counties are all pretty similar, about a little over 100,000 people. Lowndes has the most racial diversity. Pennington County has the most Native Americans, and Douglas County has far and away the oldest population. But other than that, they're reasonably comparable. So currently, when I look at these things once a week or so, each is pretty quiet. We've got about 9, 10, or 11 cases per 100,000 per day. So all of the areas now are quiet. You remember that Pennington County and Twin Falls were really active in November, December. Lowndes County has been active kind of on and off. But at this point, all of the counties are fairly low. And when I look at the number of deaths over the time, Lowndes County has 200. Pennington had 190. Twin Falls had 127. And we had 65. So, half or a third as much as these other places. So overall, that's how we're doing. I mean, at this point, there are places in the country where there's a lot of disease, and then most of the other places in the country are pretty quiet, and so all of those places have been there. So someone says, what's the best vaccine myth you've heard? Well, so here's the story, is that myths are really easy to spread, and it's much easier to make up a fanciful story than it is to make up a real story. But one of the early myths was that these vaccines contained microchips so that you could be tracked. So I'll give you a little personal story here. So I went to an engineering school for undergraduate school, and so many of my old classmates and my fraternity brothers are engineers, including several who are like world-class guys on microchips. And so, our fraternity sends back emails back and forth with all these guys. And so they've been having an incredibly good time with this. So this one guy who's really one of the world researchers on microchips, he said, these are amazing because if they're 100 times smaller than any other microchips we've made. They're transparent. All the other ones we do, you could see under a microscope. These are transparent. And all the other ones we know need to use some kind of battery technology. And this must have some heretofore unknown battery technology. We don't know. We have no clue how this would work. And they said, well, look, for anybody who's worried about getting tracked, I hope you throw away your cell phone because cell phones are far and away a much better tracking device. So One of the other myths was, does this vaccine cause sterility? That's another one of the circulating myths, a little harder to disprove, but there's absolutely nothing to suggest that this vaccine is going to affect fertility in one way or the other, either make you more fertile or less fertile, so there's not a big trouble. So can I explain what a COVID breakthrough case is? Molly asks. Well, a COVID breakthrough case is a time where somebody's is fully done with their vaccine series plus 14 days and then still get the disease. Remember, we think that once you've had a full series, you should be 90 to 95% protected. And so you'll expect that there'll be some breakthrough cases. I mean, it just the way it is. If it was 100% effective, you wouldn't, but you would expect to get some breakthrough cases. You might get some breakthrough cases. And the number of breakthrough cases we've had is lower than you would expect, suggesting that the vaccine is indeed about 95% effective. So we've looked in our county, and we've had about a dozen breakthrough cases. Some of those have been related to the variants, and again, the variants are sort of an oddball here. Some are people who had just gotten the second dose. Some are people with poor immune systems. So that's what it is. But overall, when we look at teachers and first responders and healthcare personnel who were eligible vaccine in the first round, the people who've gotten the vaccine almost never get the disease, where almost all of our cases come in the people who are unvaccinated. So we had one outbreak that was eligible for vaccine in an office. They were a medical office that was eligible for the vaccine. They didn't get the vaccine, and they got sick. All the people who were vaccinated didn't get sick. So really the vaccine works. So Ronnie says, what's happening with the J&J vaccine? Should I be concerned since I got it on March 4th? So again, as we talked about before, there are 3 cases in the U.S. and 1 case outside the U.S. where people got the J&J vaccine, had this unusual clotting thing. And so it's something to be aware of. I don't think it's any reason to not get it. It almost always happens a week or 2 after the first. And if you got it on March 4th, you're at least 4 weeks out. There were no cases after 3 weeks. So I think, Ronnie, you are in the clear. So Martin says, my out-of-country family overseas got the Astrozenica vaccine, but wasn't excited about it. Would it be a benefit for them to get the J&J when they visit in a few weeks? No. So the AstraZeneca vaccine, there are some concerns about safety, but there's been no concerns about effectiveness. It's a very effective vaccine, and there is no recommendation that if you got one brand of vaccine that you need a booster with the other. So we don't think so. So Leah says, if you didn't have any vaccine reaction aside from a sore arm, does it mean that it's not working? The answer is they looked at that, no. So in some studies, they've looked at neutralizing antibodies, and there are some people who had sore arms even when they got the placebo. And so they had sore arms, obviously did not make any antibody activity. And then there were others who had very mild symptoms and still had a nice, robust antibody response. And so why some people get muscle aches and whatever, even when they get the placebo, we don't know. But the lack of a vaccine reaction does not mean that you've not made antibodies. So Linda says, how sick did the breakthrough cases get? They were only mildly ill. So in our breakthrough cases, these recent ones, they were only mildly ill. There have been in the past breakthrough cases where people did get sicker, and Oregon reported yesterday its breakthrough cases. So they had 160 or so breakthrough cases and 3 deaths. That's 3 more than we'd want to have. But if you think of all the people who got the vaccine in the beginning, all those people in nursing homes, hospital workers and whatever, to only have 3 deaths and all those people were vaccinated, it's pretty darn good. Because as you know, Oregon is having 5 to 15 deaths a day, and so that just that small number was in the breakthrough cases suggests the vaccine really does work, and indeed that's what we see. We did have one case which we suspect, although it's never been proven to be a breakthrough case earlier, and that person was hospitalized, although they did well. All right, so a few more questions here. So one of the questions that comes up is a number called the number needed to treat. And the number needed to treat says if you have a condition and you treat people with a medication, how many do you need to treat to make a difference? And I think one of the striking things in the world is that you typically need a lot. So, for example, if we're talking about like doing a cholesterol treatment, you have to treat like 1,000 people for 5 years to get the benefit for one person, and then the number needed to treat then per year is 5,000. So as much as we think, oh, I'm going to take this cholesterol medicine, everything is going to be better, for most people it doesn't make a difference. Either they're never going to have a heart attack, in which case they've taken the cholesterol medicine and it hasn't helped them at all, or they're going to take the cholesterol medicine and have some side effect, in which case they not only did not get a good effect, but they got something of a bad effect. And so number needed to treat is sort of a number we follow. Some of these are as much as 1 million. So you would, for example, on the meningococcal B vaccine, which is the vaccine that we give to college students to prevent meningococcal disease, you need to immunize over 100,000 people to prevent one death. So that's a very high number needed to treat. And yet, many of the things that have that high number needed to treat, we still do. So when we looked at the number needed to treat for this vaccine, so it's a different which age you are, right? So if you're 12, since we've had nobody who was 12 years old who was hospitalized or died, the number needed to treat to prevent a hospitalization is obviously going to be infinite. But if we take people who are 16 above, my age group, there were about 3,500 people in the county, 35,000 people in the county who are over 60. We had about 1,200 cases. Of the 300 hospitalizations, we've had about 240 have been in those 60 and above, and all 65 of our deaths have been in people 60 and above. So how many people would you need to vaccinate to prevent one infection? So for people 60 and above, you would need to vaccinate 32 people to do that. It means that if 31 of the 32 would either never get exposed or didn't get it, so you would need to do 32. Well, 32 seems high, but a whole lot less than 5,000, like for cholesterol. You would need to vaccinate 131 to prevent one hospitalization, and you would need to vaccinate 485 people over the age of 60 to prevent one death. Well, I mean, compare this to other things we do, Shingrix vaccine or flu vaccine or whatever. These numbers are stunningly good for their ability to prevent hospitalization and death. So, again, really, really encourage people to get the vaccine. Because one of the things that we're seeing is that there is enough vaccine around now. So if you want to get a vaccine, please, please, please reach out to one of the places you can get it. There are 15 pharmacies where you can get the vaccine. That's great. There are 30 other clinic places to get the vaccine. You can get it there. And then there's these big events. Then there's these big events that you can get the vaccine at. A big event at the fairgrounds over this last weekend, really pretty amazing. Very little wait, people in and out. It really worked great. So Misty says, is the Moderna vaccine available at the fairgrounds? No. So 3 kinds of vaccines out there, the Moderna and the Pfizer, both very, very similar. We're using just the Pfizer at the fairgrounds. The Pfizer requires special storage and whatever, so it's not very well suited to going out to lots of little pharmacies and lots of little places. It's best used for those big events. That's the one, for example, that Lane County and Multnomah County are using the big one. So we're using mostly Pfizer. We also, in the last 2, used J&J, but it does not look like we'll have any J&J on the 24th. So it looks like our event on the 24th is going to be an all Pfizer event. Moderna is mostly in the clinic, so that if you look at Evergreen, Aviva, South River, Umpqua Health, the doctor's offices, they're usually the ones that have Moderna because because it's available and has the least stringent storage requirements. So you should just check with your doctor or check with Aviva. They do have plenty of Moderna. Now, one of the things that came out just today was that Pfizer asked the FDA to extend the age of usage for its vaccine from it's now 60 and above to 12 and above, which would make kids 12 to 18, basically teenagers, available to get the vaccine. This is based on a study of about 2,500 kids. So not a huge study, but they found no new safety things in that group. And they did find that all of the cases were in the placebo group and not in the treatment group, giving it a 100% effectiveness. Now, obviously, with that few kids, it's not exactly 100, but it's above 90% effectiveness. So we expect the FDA to approve this. I don't see that there's any reason they would not approve this. So I would think that by May, we're likely to have vaccine for kids 12 and above. So that is really truly a great thing. Okay, well, a couple of other things we talked about, reactions. We've had a couple of faints. Anytime you give any vaccine, you have people who faint. And then you also had 3 moderate allergic reactions, all treated, all did well. So again, we've had no serious reactions here. Now, one of the other myths that we've had is that people have looked in the VAERS system and see deaths, and then they say these deaths are related to the vaccine. So what the VAERS system is a system called the Vaccine Adverse Events Recording System, or VAERS. And what it does is if you give vaccines and anything happens to people in the time after they get vaccines, you're supposed to report it. So again, if somebody gets the vaccine a few weeks later, dies of some other unrelated thing, it gets recorded. And so you have this report. Not surprising with 100 million people getting the vaccine that some thousands of people have died for one reason or another. And then they go back and look to see if the death rate in that group was unexpected given the age and underlying conditions of the other group. And what they've seen is that, yes, there are people in the vaccine group who have died, but there doesn't seem to be any increased incidence or any other problem. And so that's a good thing. Again, the 3 J&J cases that they reported today are a concern, and so those should be carefully followed. But again, if the story was you got the vaccine and there was no chance of you dying in the next month, that would be quite extraordinary, because none of us have a guarantee we're going to make it through this next month. All right. Let's see what else we got here. There's one more question coming in here. I'll let you finish on that. So one of the things we're going to be working on the next bit is going to be working on a campaign to get people to recognize that starting on the 19th, that everyone is eligible. One of the reasons that we've heard that people don't want to get vaccines is, look, I'm young and healthy. I don't need it now. I'm saving it for the older people in the community who need it. By the 19th, we expect to have enough vaccine that no longer needs to be a consideration. On the 19th, all eligible people are going to be eligible. And so what we would suggest come the 19th, everybody should get it. So remember, our next event is on April 24th, which means everybody's eligible. So everybody should come. Everybody should come at that time. All right. So that really wasn't a question. It was to say there is no more questions. And that's great, because I have to run to my TEDx dress rehearsal. So I'll go ahead and do that. And I'll see you guys on Tuesday. Again, this is Dr. Bob Dannenhoffer, the Health Officer of Douglas County. Thank you.